untuk hari ni Sahani. Nama Cik Fatih. ID Cik betul? 123 betul? Betul. Okey. Bila kali terakhir Cik hari pertama Cik period? Saya tengah period. Tengah period. Okey. So hari ni kita akan ambil gambar dekat bahagian lutut. Saya nak minta Cik untuk tunggu sekejap sementara saya set up barang. Okey. Cik boleh duduk? Kaki mana yang sakit? Kanan. Kanan. Sentuh sikit ya. Saya menggunakan kaset 10-12. Dia punya CR adalah dekat base of the punya base of the patella. Okay. PVP saya bagi 55 ml sulfide. Okay, Cik jangan bergerak ya. Okay, sure.
This is an AP knee radiograph and it is not in a true AP because the femoral and tibial condyles and the joint between the joint space are not in symmetry. The intercondylar eminence is centered within the intercondylar fossa. The tibular head is slightly superimposed by the tibia and the femoral joint space is open. The anatomy demonstrated in this film are the distal femur, proximal tibia and fibula, and the shadow of patella. The collimation for this film is adequate because the superior border includes 1/3 of distal femur, inferior border includes 1/3 of proximal tibia and fibula, and the lateral border includes the soft tissue. The exposure factor for this projection is adequate because the bony trabecular pattern and cortical outline are visible, and the soft tissue are also visible, indicating the MAS is adequate. The normal MAS and KVP used in this for this projection is 65 KVP and 5 MAS. There is no marker for this film, and there is no artifact found. The film used is in a lengthwise, and the knee is aligned with the long axis of the film. There is no patient ID or patient name. So, in conclusion, I will reject this film because there is no patient ID or patient name, and also there is no marker place for this projection.
Angkat kaki ni. Senyap sikit badan ke kiri. Ke sini, ke kanan. Kaki ni angkat. Tahan. Cik selesa? Okey. Angkat sikit kaki. Okey. Letak. Sikit tahan ya. Okay, saya gunakan set 10-12, KBP 55, 8 ms. Cik jangan bergerak ya. Okay, sure.
This is a lateral knee radiograph. It is in a true lateral without rotation because the posterior border of femoral condyles are directly superimposed. The patella is also in profile, with the femoropatellar joint is open, and the femoral tibial joint is also open. The anatomy demonstrated in this film are the distal femur, proximal tibia and fibula, and also the patella. There is no artifact found in this radiograph, and the collimation is adequate because the superior border include the 1/3 of distal femur, inferior border include the 1/3 of proximal fibia and tibula, and the lateral collimation included the outer skin margin. And there is a marker found indicating the right side of the knee, and the exposure factor are adequate because the bony trabecular pattern and cortical outlines are visible, and the soft tissue are also visible, indicating the MAS use is adequate. The normal MAS and KVP used for this projection is 65 KVP and 7 MAS, and the film used in a lengthwise, and there is no patient ID or patient name. So in conclusion, I will reject this film because there is no patient ID and patient name.